Hello everyone. Thanks for being here. I'm Galen George. I'm the Director of Applied Science at Interscan. And today we're going to turn one of the more awkward moments in dentistry into one of the easiest wins, using objective Halimeter Plus readings to make these bad breath conversations professional, quick, and effective. So here's what you'll leave with is a 10-minute workflow that you can drop into any exam. Simple charting fields that make follow-ups a breeze, and patient-friendly phrases you can use verbatim, and also a clear way to tie these readings to a treatment so that patients understand the plan and say yes. Just some quick housekeeping before we get started, though. Susie Truitt is our distributor manager here at Interscan. She's moderating our webinar today. If you think of a question during the presentation today, please use the Q&A function in Zoom to post your question. That way I can see it and address it either at the end of the webinar or in a follow-up. If at any point you notice there is any kind of technical issue, like if the audio cuts out, the presentation is no longer visible, or anything like that, please use the chat function to inform Susie so we can address that issue. So in case you aren't familiar with us, at Interscan, we've built gas detection instruments for decades now, from industrial safety to clinical applications. The Halimeter Plus is our chairside solution for measuring volatile sulfur compounds, or VSCs, the gases that are most associated with oral malodor. And what I love about this instrument in particular is how it fits real life into the operatory. It's fast, it gives you an easy to explain number in a live graph, and it stores your data so you can show progress over time. So that combination of speed, clarity, and documentation turns a sensitive topic into a normal vital sign. The big picture goal for today is to make breath as routine as something like blood pressure. Measure it, interpret it, act on it, and track it. And just a little bit about myself. I already introduced myself as Galen George, the Director of Applied Science. My background is in biochemistry and food science. I've been with the company now for a little over 6 years, and my background is mostly in food quality and safety. So let's talk about the problem here. When the conversation is subjective, like your breath smells, it can get tense, and it can get tense fast. When it's anchored to a number, something like your reading today averaged X, our target is Y, everything changes. It becomes professional, repeatable, and action oriented. And numbers let you trend progress over time, which increases understanding and treatment acceptance. And that's the lens for the rest of this session. And some background on what you're measuring and why you're measuring it. Most oral malodor comes from volatile sulfur compounds, which are produced by anaerobic bacteria. The Halimeter Plus quantifies total VSCs in parts per billion. So it's a quick, non-invasive method to measure those VSCs. And because it shows both a live number and a real-time graph, you can literally point to the data as you explain what comes next or to interpret those readings. With this device, you add an easy SD card export, meaning you can actually plot your data, do any sort of further data analysis, create reports, and that means you have the ingredients for a confident, evidence-based conversation. So here's how to add the reading without derailing your schedule. At check-in, your team will confirm that there is a simple prep and notes of any interference and any kind of beverages or food that was consumed earlier, tobacco products, or even oral care products. And then once you have noted all those things, you run the test in a chair, and then you would fold the number into your exam findings and move straight into a plan. And so think of it as a compact, high leverage vital sign that unlocks a much more comfortable conversation. And now what I want to do is kind of tell you about the actual workflow. So you have a general idea of where it might sit inside of that workflow. But the actual process involved is something I wanted to show you, because it's about a 10-minute process. And this is the backbone of reliable numbers, and the order matters. So, in that first step, as I already mentioned, this is where you have prep instructions. So, in reminders that you send to the client at check-in, confirm that there was no food or flavored drinks, smoking, or oral hygiene in the last 3 to 4 hours. Water is totally fine, but making sure that they don't have any of these potential interference prevents a lot of false highs and odd traces. So emphasizing that this is just like preparing for any other test, simple habits that make the number leave. Step two is stabilization. So in the process of taking these measurements and the chair, have the patient gently close their mouth and breathe through their nose for about 3 minutes. This creates a quiet mouth, so we're sampling intraoral gases rather than whatever was just introduced. While that stabilization runs, you can be reviewing the chart or confirming medication so that there's no just dead time. Um, and then in step three is where we actually start doing things with the device. So I actually have a halimeter here with me, and I have it kind of set up already. And actually, let me turn my blur off on my camera so you guys can see that a little bit better. Da-da. There we go. So here's the holometer device. I'm holding it right now. I've already got the device turned on, and stable sensor has stabilized. And so we're kind of at step three here. So step three is while that patient is having their mouth closed, stabilizing, you would take something like this fresh disposable straw. We sell these also. They come with the device, but they're easy to purchase. They're sterile. They fit really easily. They just fit right into this adapter here, and you'll feel it stop against the back of the adapter. That's how you know it's loaded successfully. And then what you're going to do next is perform a quick zero or warm up. And so on the device itself, when I transition it from off to on, it's going to begin taking over time samples of the air, and it's going to start giving me what the sensor is recognizing as background. And sometimes that can creep up over time. As you can see on my device, it's already at 0. So if that value isn't at 0, what you can easily do is you can just go up to click the up arrow, and I'll highlight the words 0. And then you would just click enter, and then that would bring that reading and 0 the baseline or the background. So once you've done that, you have your straw ready to go, the sensor zeroed. You're ready to start actually going into the next phase, which is the actual data collection phase. So in the data collection phase, we have essentially 3 consistent samples that are going to be taking place, and then you're going to be collecting the average of those 3 samples. This allows us to make sure that the value is a true value and that there's no outliers that are causing any kind of issues, and you don't want to take a single reading and take that as the truth. And so how this would work is you would begin by placing the straw about 1 to 2 inches inside a slightly open mouth. And so you would do that, and then you would avoid doing any kind of having the patient do any kind of tight lip seal. There's no blowing or sucking. The instrument itself has a pump, and that's drawing the air out of the mouth. So they should have a slightly open mouth that prevents, you don't want any kind of seal, because that could create issues with the pump itself. You want there still to be a free flow of gas, but you don't want it to be wide open to allow for interfering gases to enter the system as well. You want to be measuring what's in the mouth, what that clean mouth that the patient had as they prepped. So once you have done entered the straw into the patient's mouth, they can close their mouth, leaving a small gap, and then once that is in place, you actually begin taking your sample. And that first sample is going to take roughly 35 seconds to measure. While that sample is being measured, you actually can view a live graph. So if I actually move this to sampling mode here, what I can do is here in a couple minutes, I can show you a live graph of the actual of the data as it's being collected. I can't obviously do it on myself while I'm trying to talk, unfortunately, but I can show you what that looks like here in a little bit. So once you've run that first sample through, and it takes about 35 seconds, you'll see in the live graph that there'll be a rise, and then there'll be a peak, and then it's going to return back towards baseline. And that's your visual confirmation that you captured a true peak, that you captured a true reading. If it doesn't have any kind of peak to it, it's just like a kind of a flat, it doesn't really do anything, then that is a false reading that you'll need to repeat. Um, but once that first reading is done, what's going to happen is the device is automatically going to reset back to a hold pattern for 3 minutes, which is the patient then needs to close their mouth again, allow it to prep for 3 minutes, and then it'll automatically then indicate with 3 beeps. It'll beep 3 times, and that means it's time to begin the sampling process one more time. And then it'll do that a third time. So it'll basically repeat, give you 3 replicate readings of the same patient's mouth. And then once you've recorded all 3 peaks and charted those, and then it'll show you the average on the device. You can also record them on your own chart individually, but it'll show you the average value of all 3 readings directly on that device. Then you can use that data to then further talk to the customer about, the patient about, what you were seeing in today's readings. So the live trace also isn't just a technical helper. It's something that obviously you can use when you're using the device to help you understand that you're taking a good reading and understand where the values are at. But it also allows you to kind of help explain to the patient, what's going on during the test process and what you're seeing. Um, and so that's a very useful feature to use. And it's a nice visual to show the patient so that they understand how the test is being conducted. So when you're charting your fields, after taking your data, you've collected the three samples from your patient. What you're going to want to do is chart that average value, pair that average value with context so that your follow-ups are smarter. You're going to want to record the average and the 3 individual readings, and then add a small set of fields, things like tongue coating index, plaque score, xerostomia medications, whether there was a recent meal, coffee, mouthwash, or smoking. And then you can include a brief counseling note and the numeric goal you and the patient agree on today. So these details will, take seconds and pay off when you show progress at the next visit. So really quick, jumping back, you can hear right now that this is actively sampling because there's a beep every couple of seconds, every 3 seconds, it'll beep to let you know that it's actively sampling. And it's showing a countdown here. So there's 3, 2, 1. And so it's saying I didn't have it in anything. So the peak was at 0. But if I wanted to look at a live graph, you could see that before, since it's just kind of an error and it's taking very, very low values, that there's just a bunch of random peaks in there. So that's clearly a bad reading. So that's a good indicator that you would not use that as your reading, because you're just seeing all these random peaks all tightly next to each other as opposed to one smooth increase and decrease. So that's a good indicator there and a good visual tool. So I'm going to go ahead and stop that on the device so it doesn't keep beeping on us while we're talking. But so yeah, so when you're talking about using this device in your practice, you want to keep interpretation consistent by adopting some kind of clinical range, something like a green, yellow, orange, red, or some kind of other, system that you have so that you can use that in the same way every time. Tell the patient which zone they're in and immediately link it to next steps, right? So most importantly, we need to celebrate trends. A 30 to 50% drop from baseline is a win even before they land in the green. So if there's somebody who is suffering from really severe halitosis, And even though they aren't, all the way back to standard normal levels of VSCs, if they see a significant drop, that's still a win. And that's something that you'll want to celebrate with your patient. And the graph on the device helps make that progress visible, right? So that live graph shows that visible progress drives adherence. And that allows the customer to kind of stick with the plan that you've created with them, or the patient, I should say, for the kind of the things you can say to the patient to make this a more clinical approach as opposed to a casual discussion about bad breath, is you're going to want to normalize the test and keep the language clinical and not personal. Use phrases that make the reading feel like any vital sign, and then give a clear timeline for the recheck. The aim here is clarity and confidence. So anchor the discussion to the number, outline a simple plan, and schedule the follow up so momentum isn't lost. And then you're going to want to tie the number to an action that the patient can take today. So if the reading is elevated with heavy tongue coating or plaque, add deep plaquing or guided biofilm therapy and reinforce home care. If periodontal signs are present, then you can move to your periodontal therapy pathway, and continue that VSC tracking. And you'll often see that number improve alongside periodontal health. Um, and for very high or refractory cases, you're going to want to resample just to be safe. If you see something that seems extraordinarily high, um, and then that will allow you to rule out interference, things like coffee if they ate a mint before coming in, or mouthwash, in that half hour before they came in. And then you also need to consider extra oral sources in collaboration with your medical colleagues when that's appropriate. Um, there is also the potential for, as I mentioned, if you aren't doing this properly and having them condition their mouth with their mouth closed, if you just simply put it in open air, there is obviously interfering gases potentially in the atmosphere as well. So you'll want to make sure that you're, following the procedure as closely as you can, with sampling out directly from the patient's mouth with minimal interference from the outside environment. So some key features to look at for in our halitosis measurement device, and what we have excelled at with this Halimeter Plus. Um, there's a lot of different things that we can do with this device. There's a lot of great, obviously, actual insights you gain from it. Um, but where the tool really earns its keep is that you get real time numeric and graphic display data. It's a really quick warm up. It's a 10-minute workflow, as you saw. And it's doing active sampling. So the technique is easy and repeatable. You don't have to rely on people blowing into something. You don't have to rely on any kind of other techniques that could potentially cause you to have varying data in between visits or in between patients. Um, the data storage on the SD card makes it really effortless to export that data for any kind of case presentation or just doing further data analysis and trending. And then the nicest thing about these devices is that when it's time to swap your sensor, this electrochemical sensor in here, it's designed to be extremely straightforward. We have an interchange sensor cartridge system that minimizes your downtime. So if I actually power this off so that it doesn't beep at us, I can actually show you how easy it is to pull out a sensor cartridge. So you see in the back here, it's just an external cartridge. And if I just press these two uh, buttons down here, I just pull it out. And then when you put your new one in, you just pop it back in on the back there. So it's very simple to change out your cartridges. You don't have to worry about doing all sorts of extra calibration, having standard gases around, all that stuff. It's a very simple swap out every time you need to replace your sensor. So I wanted to just kind of give a really quick example of how this device might be used, right? A work have a mock real world example. So let's say in the first visit, you see elevated average VSEs with a high tongue coating index from your patient. So you did your halimeter readings, they had elevated VSEs, and you also charted that they had a high tongue coating index. Um, the first thing you would do is implement some kind of simple plan. Daily tongue cleaning, an alcohol free zinc option if they prefer, a rinse or a gel, interdental cleaning, and hydration. 4 weeks later, the patient comes back into the office, um, and you notice with the limiter that the average VSC drops meaningfully, and that coding index improves. And the patient reports that they have more confidence. They aren't noticing, people aren't noticing their bad breath. Um, uh, and then what you can do is put your first graph that you have from your Halimeter Plus beside the follow up graph. And they can actually visually see that peak, how high it was in the first visit versus that 4 week checkup, how much lower it is. And then that will allow the patient to instantly understand and then, reinforce inside of them all the work that they did with your plan that you put together, the daily tongue cleaning and all those other things. And that reinforces, what they worked on and allows them to, carry that through. And then you can continue to see that progress at the next check. So that's kind of how this device would be implemented in a real world dental practice. Now, there's lots of advantages, as I mentioned, to using the instrument overall. I showed you it's a very quick, simple process to take measurements. Um, I can do obviously, a more detailed demo for you if you are interested in learning more about the device and all the different features of it. That's something that we offer. It's a service that we offer on our website. You can just easily, you know, book a demo with me, and I can run you through the whole operation of the device. But it's truly as simple as I showed you. There's, not very much. It's not too excessive in its functions. It does exactly what it needs to do very well, and gives you simple, actionable data. So what I want to do now is jump into our Q&A session. So we've allotted about 5 to 10 minutes here for Q&A today. So any questions I'm not able to get to during this Q&A session, I will follow up with personally via email. So if I can here, I will open my Q&A box and see if there's anything. If not, I know that there's a few things, extra little tidbits of detail I can give you guys regarding the actual device, and expected readings and outcomes. So I'll pull up the Q&A just in case something comes in. I don't see anything right now, but um, one thing that the a question, the very first question probably for most people is, what levels of VSCs are, commonly associated with what degrees of halitosis, right? Like when do we know it's above average? That's something that's kind of tricky to answer. It's going to vary region to region, and some people have a higher baseline than others, but don't have bad breath. Um, so it's something that you need to establish at yourself as a baseline. Now we have noticed, and people have done research and shown that something like 80 to 120 parts per billion is kind of the normal range for VSCs and people without halitosis. But it's still something that you yourself will want to chart as a baseline and establish that baseline with your patients, so that you can go forward and give them correct plans of action when it comes to caring for their breath. Um, the other thing that I would say about this device is, when it comes to actually implementing it into your practice, you don't want something that's going to take up a ton of extra time, right? So this is a objective instrument that'll give you objective readings, and it is a very simple process to incorporate it into your current practices. And so, like I said earlier, it's as simple as something like doing blood pressure readings, right? Where it's just as long as you can incorporate, that in your process, you're going to turn your holimeter on, when you get it in the morning, you can do you can get it stabilized before the patient comes into your office. And then once they come into your office, the very first thing they do is close their mouth for 3 minutes, and then you go in and do your sample, and it takes, just an extra, maybe about 5 to 10 minutes out of your normal workflow. So that's something that we hear a lot is, is this going to slow down our schedule? And it's not really going to slow down your schedule if you follow that workflow. And it's, things while this thing is stabilizing, while the patient is, conditioning their mouth, then yeah, you can do other things. You can look at review your charts. You can, do other tasks while that's happening. So it doesn't kind of create any kind of dead time. Um, and then another question I think commonly with this instrument is how are we actually documenting the data? And so one common way is to on a physical chart write down the numbers as you see them appear on the device as you're taking the measurements. And then afterwards, if you do have some kind of other data system, or if you need to put together any kind of reports or anything, that data is always stored on this SD card for you to access it in Excel format, so like a .csv format. Um, so yeah, so that's something that we hear a lot is, how exactly is that am I going to access that data? So there's kind of usually a two pronged approach, that it's in real time you're writing down the values, and then afterwards if you need to do anything, then that's when you can access the data from that SD card. So yeah, so those are kind of common questions. Steven has asked if I can show breath sampling. I can, I guess, if you want me to like demonstrate where I'm putting the tube in my mouth and how I'm closing my mouth, if that's what you're referring to. But I guess I could also go through a full on measurement cycle, and I would have to hold my breath, or not hold my breath, but close my mouth for 3 minutes here in silence. And then we would have to wait another couple of minutes for it to take the measurement and move into the next cycle. So I could do that. I did. So, okay. So if I'm putting the straw in my mouth, then and this is a clean straw. I just opened this, so don't worry, everyone. But I'm pressing it on the back of the patient's tongue, and you're not clamping down with your teeth or your lips, and it's only going about 1 to 2 inches back. So it's not like you're, putting it all the way back into their throat. So you would hold it right there. I don't know how well you can see, but mouth just very slightly open. Like you're not clamping down, but you're not also going like that. So that's how you would take the actual sample. This is actually actively on right now, so I can show you my preliminary reading here part. Looks like I was at I just took it out, but I was at about 110. It's decreasing now that it's out of my mouth, but I was at around 110. But yeah, so it's if you have it in the on mode, it's just consistently sampling and instead of doing the reconditioning and resampling. But yeah, so it looks like there aren't many other questions at this time. But if you do have a question, you can always email us, sales@gasdetection.com. You can visit our website, halimeter.com, to learn more information. You can always give us a call as well. Here's our phone numbers listed here on this slide. We will send this recording out to everyone. If you do have other questions, like I said, you can always just reach out directly to us. We're happy to help answer any questions you have. So thanks for spending time with me today. Remember, you measure, normalize, plan, recheck, and then you can celebrate the wins. So if you're ready to see how you can use this device in your own workflow, you can book a demo with me. And that's all I have to say for today. Thanks everyone for joining us. Have a great rest of your day.